Dear students, welcome back. In this session, we are going to discuss about liver. Liver is the largest gland in the body and it is red-brown in color. It is richly vascular, pliable and friable. Okay, if you see the situation, it occupies the right hypochondrium. So this is the right hypochondrium and extends into epigastrium and also left hypochondrium. So this is the situation of the liver. If you see the shape, it is wedge shaped. It has an apex, a base and right lateral surface, anterior surface and posterior surface. Okay, and this one is superior surface and then the inferior surface. So it is a wedge shaped and it is having an apex, a base or right lateral surface. This one is apex, right lateral surface, an anterior surface and posterior surface and superior surface and inferior surface. These are the surfaces of the liver. Okay. Normally if you see the size, in the fetus and children, it is large when compared to the body. Its weight being 1/18th of the total body weight. In the adults, its size becomes relatively smaller and is only 1/50th of the body weight. Its maximum AP measurement is 14 centimeters and maximal vertical diameter is 16 centimeters. And the maximum transverse diameter is about 18 centimeters. So this is about the size of the liver. And if you see the lobes, mainly the liver is divided into two lobes anatomically. So this is left lobe and this one is a right lobe. Okay, they are separated from each other by a line of attachment of the falciform ligament. So this one is the falciform ligament. So this is the falciform ligament which separates the right and left lobes. Okay. And by a fissure for ligamentum venosum. And by a fissure for ligamentum venosum. And by the groove for ligamentum teres or round ligament of the liver. Okay, and it is having another lobes called as quadrate lobe and caudate lobe. So these two lobes are mainly related to the right lobe. Now we will see where these lobes are actually present. Okay, yes. So this is the liver which we can see from behind and below. Behind and below. Quadrate lobe is seen on the inferior surface of the right lobe. This is the quadrate lobe which is seen in the inferior surface of the right lobe. It is bounded posteriorly by the hilum. So this one, bounded posteriorly by the hilum of the liver, anteriorly by the inferior margin of the liver, on the right side by a fossa for gallbladder. Okay, on the left side by a groove called ligamentum teres. So this entire part is the quadrate lobe. Okay. Now we will see another lobe called as caudate lobe. It is chiefly situated on the posterior surface of the liver and its lower end is seen on the inferior surface. So this is the caudate lobe. Okay. And it is bounded right side by the groove for the inferior vena cava. This one. On the left side and above by the groove for ligamentum venosum. okay, and below and in front by the porta hepatis or hilum of the liver. So these are the lobes of the liver. Okay. And if you see the functional lobe, the right functional lobe is that part of the liver which is drained by the right hepatic duct. Okay. And these are all the lobes present in the liver. So anatomically there are two lobes, right and left lobes, and they are separated by a line of attachment called falciform ligament. And on the right side of the liver we can find another two lobes called as quadrate lobe and caudate lobe, which can be seen on the inferior surface of the right lobe. Okay, now we will see the peritoneal folds of the liver. Yes, so the peritoneal folds of the liver, or one is the falciform ligament, okay, and next one is the right triangular ligament, left triangular ligament, and you can find the lesser omentum, okay, lesser omentum, and some of the peritoneal folds called as upper layer or anterior layer of the coronary ligament. Next one is the lower layer or posterior layer of the coronary ligament. Now we will see where all these ligaments are attached. First one is the falciform ligament. It is a sickle shaped fold. It is a sickle shaped fold which stretches from the liver to the diaphragm. Which stretches from the liver to the diaphragm and the anterior abdominal wall. So here the diaphragm, and on the anterior aspect it is related to the anterior abdominal wall. It consists of right layer and left layer which are attached between the right and left lobes of the liver on its anterior as well as the superior surfaces. Okay. Next one is the right triangular ligament. The upper end of the before this triangular ligament we have to discuss about the coronary ligaments. Upper layer of the coronary ligament. It is the continuation of the right layer of the falciform ligament. It stretches between the posterior-superior aspect of the right lobe of the liver to the diaphragm. Okay, to the diaphragm. And the lower layer of the coronary ligament, it stretches between the posterior-inferior aspect of the right lobe of the liver and the diaphragm. So both these coronary ligaments are on the right side only. Okay. Now this right triangular ligament, the upper and lower layers of the coronary ligaments when traced to the right are continuous with each other at the right triangular ligament, which is a short triangular fold that connects the upper surface of the right lobe with that of the diaphragm. So simply we can say the right triangular ligament connects the upper surface of the right lobe of liver with the diaphragm. Left triangular ligament, it is a short triangular fold connecting the upper surface of the left lobe of the liver with that of the diaphragm. If you see the lesser omentum, it is a two-layered fold of peritoneum connecting the lesser omentum of the stomach with that of the liver. These are the peritoneal folds of the liver. Okay. Next, we will move on to the relations. Okay. The superior surface is related to the diaphragm. So this is the superior surface related to the diaphragm. And the anterior right lateral surface. So if you can see the right lateral surface, it is also related to the diaphragm. And if you see the anterior surface on the right side, it is also related to the diaphragm, and which is separating this surface from 5th to 10th ribs and their costal cartilages. Okay, superior surface, right lateral surface and the anterior surface are related to the diaphragm only. Okay, if you see the posterior surface, it is having, so this is an inferior surface, but we can see the posterior aspect here. It is a small and triangular outline. In the middle there is a depression which is produced by the vertebral column, and the fissure for ligamentum venosum. So here we can find the ligamentum venosum, and we can see there is, and it is related to the inferior vena cava on the posterior aspect. Okay, and the liver is having a bare area. So the liver is having a bare area. Here you can find the bare area. So here in between the two lobes you can find the bare area here. So this bare area of the liver is a rough triangular area to the right of the inferior vena cava. To the right of the inferior vena cava. Okay. And the remaining relations which we can see on the inferior surface. So this is the inferior surface relations. The visceral surface, this is also called as visceral surface, which is oval in outline and is divided into right and left lobes by a fissure called as ligamentum venosum and a fissure of ligamentum teres. So ligamentum teres and the ligamentum venosum separates again this one into right lobe and left lobe. On the left lobe there is a prominent region which is related to the stomach. So this is the prominent one. This one is related to the gastric area, we can call it as. Okay, on the right lobe, fossa for gallbladder. So we can see the fossa for gallbladder, and to the right of the fossa there is an area related to the upper end of the second part of the duodenum. So we can see some of the impressions, which those are the visceral organs related to the inferior surface of the liver. One is the gallbladder and colon, and also duodenum is related, and right kidney and right suprarenal glands are related on the inferior aspect of the liver. And if you see the blood supply, okay, if you see the blood supply, it is mainly brought about by the right and left branches of the hepatic artery as well as the portal vein. Okay, they enter portal vein, which enter the porta hepatis, and it divides into 8 segmental branches. Each segmental branch supplies a definite part of the liver called the hepatobiliary segment, which is drained by a segmental tributary of the bile duct. The 8 biliary segments are, so this one is right and left. So the right side is divided into anterior and posterior divisions, whereas left side divided into medial and lateral segments. This one is anterior and posterior. So here the segments on the right side are right upper anterior, right upper posterior, right lower anterior, and right lower posterior divisions, whereas on the left side it is left upper medial, left upper lateral, and left lower medial and left upper lateral. So these are the segments. Okay. So in this way the segments are divided. In the center of each biliary segment, a hepatic artery, a branch of portal vein, and a branch of hepatic duct lie together in a connective tissue called as a portal triad. Okay, like this the blood supply to the liver is taking place. The branches of the hepatic arteries and the portal vein open into the sinusoids of the liver, which in turn are drained by the radicals of the hepatic veins. And these hepatic veins are not segmental but are intersegmental in position and function, and finally it joins into the inferior vena cava. This is all about the blood supply of the liver. If you see the nerve supply, the hepatic flexes of nerves accompany the hepatic artery and portal vein, contain both sympathetic as well as parasympathetic. The sympathetic is coming from celiac ganglia, whereas the parasympathetic from vagus fibers. The sympathetic fibers are ultimately derived from T7 to T9 spinal segments. Now we will see the lymphatic drainage. The lymph vessels from the inferior aspect run towards the hilum of the liver and end in the portal nodes. From the upper and anterior parts of the lymphatics pass out between the falciform ligaments. So pass out between the falciform ligament and end into the retrosternal nodes. And the lymphatics from the posterior parts accompany with the inferior vena cava, end into vena caval nodes situated near the vena caval orifice of the diaphragm. This is all about the liver. Thank you.